Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today I want to talk about CPAPs and orthodontics. And if you should, this is happening actually pretty frequently now. I feel like the rate of patients going on CPAPs is exponentially increasing, not only in my own world, in my own life, what I see in other people's practices. I know at the moment, quote unquote, a CPAP is the gold standard supposedly for sleep apnea, but it is a terrible patient experience. Most patients hate it. I think there's other things that can be done that can work just as well, that are more interceptive, interventional. I'm not telling people to get off their CPAPs by any means because I don't want to get sued. But as far as you as a dentist taking ortho patients who use CPAP, I would not. That's generally always been my policy. It's something you probably want to add to your screening forms. You may not know, and the patients are getting younger and younger. So the reason why is maybe this face mask here in this picture is not the best example because there's ones that are definitely bigger, that have more elastic bands. This one's a little more slimline, but even just having this strapped to your face, this is going to affect the movement of the incisors 100%. It may prevent movement being complete. It may make the movement unpredictable. It is a counter force to what you're doing. So when we're doing these Invisalign treatment plans, or we're moving teeth, or we're setting up to move with braces, in our minds, we're not thinking there's going to be a counter force pushing against it, right? It's kind of like tug of war. You're pulling and they're pulling, so you're pushing and they're pushing, and it's going to counteract what you're trying to do. So if you're trying to straighten front teeth here, and then this nose piece comes down to where the front teeth are, it's not going to straighten as predictably. It's not going to move like the ClinCheck said. It's a counterforce. Maybe you can do it, and the chance of it honestly retaining is low. You're probably going to relapse quickly. You're probably not going to get the outcomes you want to get. And a lot of times, sometimes just doing orthodontics, especially in younger kids, but even in young adults, can really help with the airway, with the nasal breathing and other things. So it may not even be necessary. And sometimes you can go from orthodontics to getting some type of dental-based oral device, some type of mandibular advancing device built into your retention or worn over your retention, and it works just as well. Plenty of patients have switched. I'm not saying that you can and it's perfect, but it's something to keep in mind. So do I recommend taking patients who use CPAP? Nope, I'm sorry. There are probably some orthodontists who don't have a problem with it, who are very experienced with it. They probably charge a lot more. And if I did, I would charge probably double, but you can't always do that if you have an insurance patient. And that's the hard part, right? Because you can't really discriminate. So, I think it's safer just to say no thanks and not take these patients. That would be my advice. All right, thank you.